Okay, so today we are demonstrating the physical assessment competency. So we're going to go ahead and start.
Gather and prepare the necessary equipment. Perform hand hygiene and introduce yourself to the patient and family if present.
So I got my stethoscope. You're going to have a double stethoscope so we can listen in too. You're going to need a light tongue depressor and something for smelling. Either it's going to be an alcohol swab or something to test the olfactory nerve. Knock on the door, knock, knock, wash my hands. Hi, my name is Liz. I'm going to be your nurse today. And then can I have your name and date of birth?
After confirming the patient's identity using 2 patient identifiers, explain the procedure to the patient and family if present and provide privacy.
So then I check the name and date of birth. I'm going to provide privacy. And I'm going to say we're going to do a head-to-toe physical assessment today. Do you have any questions? They said no.
Raise the patient's bed to waist level when providing patient care. Perform hand hygiene.
Wash my hands before I touch my patient.
Starting with the head and neck, assess the level of consciousness, observing their speech for clarity and the appropriateness. Are they alert and oriented? Times 4.
So I'm going to say, can I have your name? They're going to say, my name is Jane Smith. Do you know where you're at? I'm in the hospital today. Do you know the date? The date is April 22nd, 2021. So I'm checking to make sure they're alert, oriented, times person, place, location, and circumstances.
Assess their affect and behavior. How are they acting today?
They're acting appropriately.
Inspect the hair distribution, noting any thinning, alopecia, or use of wigs.
So now I'm going to be looking at my patient.
While inspecting the hair, inspect the back of the head for any skin breakdown.
Okay, looks good.
Assess visual acuity with a Snellen chart. You will have your patient stand up out of bed 20 feet away from the Snellen chart. Ask them to read the smallest line of letters possible, first with both eyes, and then with one eye at a time. Note whether the patient's vision is being tested with or without corrective lenses.
So you will have your partner stand up and actually perform this on the Snellen chart.
Remove glasses if the patient is wearing them. Assess PERLA. Verbalize. Are the pupils equal, round, and reactive to light? What is their size? And is there accommodation? This tests cranial nerve number 3.
So you're actually going to do that. I got a pupil size of, we'll say 5.
Ask the patient to hold their head still and follow your finger with their eyes. Moving slowly up and down, right to left, diagonally up and down to the left, and diagonally up and down to the right. This tests cranial nerve 3, 4, and 6. Hold your finger about 6 to 8 inches from the bridge of the patient's nose. Move your finger towards the patient's nose. The eyes should converge. This tests cranial nerve number 3, 4, and 6. Continue assessing the eyes. Assess the sclera color. Assess the conjunctiva for color and presence of drainage. Assess for any hearing aids.
Make sure they don't have any hearing aids in. So as you're doing the eye test, you can say, okay, I'm doing this, and then tell me which cranial nerves you're testing.
Assess for the presence of ear drainage and any color to the drainage.
There's no drainage noted, no hearing aids noted.
Moving to the nose, assess for nasal flaring. Assess for any presence of nasal drainage and any color to the drainage.
Now, when you're doing this at another student, they're going to have a mask on. The mask must stay on, so you're going to have to verbalize this step.
Ask the patient to close their eyes, occlude one nostril, and identify the smell of different substances, such as alcohol. This tests cranial nerve number 1.
So you would ask your patient, your classmate, to occlude one side of their nostril, have them occlude their nostril, and see if they can smell. Then we'll do the other side and tell me what cranial nerve you're testing.
Stand 1 to 2 feet away from the patient, out of the patient's line of vision. Ask them to cover the ear not being tested. Determine whether the patient can hear a whispered sentence or a group of numbers. This tests cranial nerve number 8.
So So go ahead and step out of your line of vision. You can have them turn their head away, have them cover one ear, and I want you to whisper a group of numbers or a sentence, and can they repeat it back to you, and then test the other ear.
Moving on to the mouth, assess the color and the moisture of the mouth, lips, tongue, and mucous membranes. Assess for any presence of oral lesions or sores.
Again, your classmate's mask must stay on, so you have to verbalize this step to us.
Assess the condition of teeth and gums. If dentures are present, remove and assess the gums. Put on gloves. Ask the patient to open their mouth and say ah. Observe an upward motion of the soft palate and test their gag reflex by touching the posterior pharynx with a tongue depressor. This tests cranial nerves number 9 and 10.
So yes, your classmate's mask must stay on. Put your gloves on and tell me how you would test the cranial nerves, and tell me what you would do.
Assess for facial symmetry. Have the patient smile, frown, wrinkle their forehead, and puff out their cheeks. This will test cranial nerve number 7.
So I would say I need to test cranial nerve number 7. I'm going to have you smile, frown, puff out your cheeks, wrinkle your forehead, and you're going to watch to make sure that it's symmetrical.
Ask the patient to stick out their tongue and push against the cheek with the tongue. Cranial nerve number 12 is tested.
So I need to test cranial nerve number 12. Can you stick out your tongue and push against each cheek separately? They can do that.
Ask the patient to open and clench their jaws. This tests cranial nerve number 5.
So I'm testing cranial nerve number 5. Can you open and clench your jaws for me? Yes, they can.
Moving down to the neck, assess the trachea. Note if it's midline or deviated, and then assess the neck for range of motion. Have the patient touch their chin to each shoulder, their ear to the corresponding shoulder, and chin to chest, and putting their head back as far as possible.
Okay, so have your patient do that.
Place your hands on the patient's shoulders while he or she shrugs their shoulders against resistance. Place your hand on the patient's left cheek and then the right cheek. Have them push against it with each time. This tests cranial nerve number 11. Palpate the left and then the right carotid arteries. Grade the strength.
So I'm going to feel the left, and I'm going to feel the right. Do not feel both carotid arteries at the same time. That's called a chokehold.
Inspect shoulders for any skin breakdown.
There are no skin breakdowns on your shoulders.
Assess for visible protrusion of jugular veins while the patient is sitting in bed at a 15 to 30 degree angle.
So lower your patient down, have them turn their head to the side, and I'm going to check to see if there's any jugular vein dissection.
At this time, you will grab your stethoscope and auscultate the carotid for vascular sounds by placing the stethoscope over the carotid artery and listening with the diaphragm and then the bell.
You're going to check both sides.
Moving on to the chest. Assess the chest for color, temperature, and moisture of the skin.
So you're going to verbalize. I'm going to check their chest for any moisture, skin breakdown.
Verbalize their respiratory pattern. Do they have a regular pattern? Is it non-labored or is it irregular?
So their chest is good skin tone, they're breathing regular, non-labored.
Assess thoracic expansion by standing behind the patient and placing both thumbs on either side of the patient's spine at the level of T9 and T10.
So you can have your patient turn sideways, sit on the bed. You're putting your hands by T9, T10, and they're going to have to take a deep breath, and your hands should move symmetrically up and out.
Now you will auscultate and listen to those lung sounds. Auscultate the anterior lung sounds, making sure to hit all 10 sites.
Okay, so when you're hitting your 10 sites, the first 2 sites are above the clavicle. Every time I put my stethoscope on your chest, can you take a deep breath for me? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Auscultate the aortic, the pulmonic, the tricuspid, and the mitral heart sounds at this time.
So I'm gonna go ahead and listen to your heart sounds. In the second intercostal space on the right sternal border is my aortic. Well, listen. I'm gonna go straight across the border to the left side over my pulmonic, down to the fifth or fourth intercostal space for my tricuspid, and then to my midclavicular line for my mitral, which is also where I'm gonna listen to my apical pulse. So I made a nice little cross, down, over, pattern.
Auscultate the apical heart rate for 1 minute with your instructor. Measure and document the rate and the rhythm. You must be within 4 beats.
So you're gonna listen for a whole minute. Make sure you have a watch with a second hand so you can count, or you have a clock nearby. I got 64 regular strong.
Now you're going to auscultate 4 lateral lung sounds on each side.
1, 2, 3, 4. I'm gonna walk around to the other side of the bed and do the same thing.
Auscultate 10 sites on the posterior lung fields.
So I'll have my patient turn, and I'm gonna listen to 10 sounds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Verbalize the breath sounds that were heard on the anterior, lateral, and posterior fields.
So all breath sounds were clear and equal. There was no crackles, no signs of distress.
At this time, assess the use of any accessory muscles or use of supplemental oxygen.
So my patient was breathing regular, no distress, clear lung sounds. They were not using accessory muscles, and they do not need oxygen.
Have the patient roll to one side to assess the skin of the lower back and buttocks. Assess for scars, tattoos, piercings, and incisions.
So you can do this while while you're listening to your breath sounds on the back. Tell me you're looking at the back of the patient too.
Moving on to the abdomen, assess the skin color and the moisture. Assess the bowel patterns of the patient. Ask them how often are they having a bowel movement? When was their last bowel movement? Describe that bowel movement. Assess for presence of gas.
So I'm going to check your abdomen now. Skin is intact, it is dry. When was your last bowel movement? Was it hard, firm, or do you have some diarrhea, any pain? Are you passing gas? Do you have regular bowel movements?
Auscultate all 4 quadrants of the abdomen.
So there we go. 1, 2, 3, 4. And you are listening to see if the bowel sounds are regular, hypoactive, hyperactive, or absence.
Palpate the abdomen lightly in all 4 quadrants using the pads of your fingers. Assess for rebound tenderness by applying pressure to the abdomen and quickly removing your hand. Ask the patient if they experienced any pain.
So I'm going to go ahead and press down. When I take my hands away, I want you to tell me if you feel any pain. Do you feel any pain?
No.
No? Any pain?
No.
How about now?
No.
All right.
Place your hand on the abdomen with your non-dominant hand. With your index or middle finger of your dominant hand, strike the middle finger of the hand on the abdomen. Determine if the sound heard is tympanic or dull.
Okay.
Assess the urinary system at this time. Assess for frequency or urgency. Ask the patient how often do they urinate. Is there burning or pain? What is the color? Is it clear? How much are they urinating each time?
So can you tell me about how you're urinating? Any pain?
No pain.
How often do you urinate?
About 5 or 6 times a day.
Is it clear, cloudy? Is there an odor?
No odor. It's pretty clear. It's a light yellow.
Okay.
At this time, lay your non-dominant hand flat over the costovertebral angle, which is below the 12th rib between the spine.
Non-dominant hand.
Make a fist with your dominant hand and firmly thump the fist onto the flat non-dominant hand. Ask the patient if they felt tenderness or pain while you were doing this.
Any pain or tenderness when I do this?
No.
Okay.
At this time, you will assess the upper extremities of your patient. temperature, and moisture, paying attention to the elbows for any skin breakdown.
Both sides, they have 2 arms.
Assess for the presence of edema. Grade pitting edema if it is present.
There's no edema present, skin is intact.
Assess for skin turgor. Is it tenting or elastic?
Okay. It is elastic.
Assess the color of the nail beds and assess the condition of the nails.
Nail beds look good. There is no clubbing noted. Then I'm going to check capillary refill. Capillary refill looks good.
Palpate and compare the radial pulses for strength and regularity.
Radial pulse is regular. I'll check this side. Check my nail beds. No clubbing noted. Capillary refill looks good.
Assess the ability to move their upper extremities freely.
All right. Any problems moving your arms around?
No.
Okay.
Assess bilateral arm muscle tone and strength. Place your hands on the upturned forearms while the patient pushes against with resistance. Then place your hands under the forearms while the patient pushes down.
You're going to do both sides. Do both sides at once, that's easier.
Verbalize the strength and equality.
She has equal strength on both sides, upwards and downwards.
Assess bilateral hand grasp and verbalize the strength and equality.
Go ahead and squeeze my fingers. It is equal and strong on both sides.
Assess for any numbness or tingling in the upper extremities.
Do you have any numbness or tingling?
No. Now you will assess the lower extremities. Assess the skin color, temperature, and moisture, and now you will pay attention to the heels for any skin breakdown.
Okay, there's no skin breakdown. Skin is intact. It is dry. Both heels look good.
Assess for edema and grade pitting edema if it's present.
No edema noted bilaterally.
Assess the hair distribution on the lower extremities and if there's a presence of any wounds or ulcerations.
Hair is evenly distributed. There is no wounds.
Assess the color of the nail beds and the capillary refills within the toes.
Same thing. You're checking for capillary refill. There's no clubbing noted. Both feet.
Palpate bilateral dorsalis pedis pulses and verbalize their strength and equality.
Pedal pulses are equal.
Palpate posterior tibial pulses and verbalize the strength and equality.
Equal.
Assess the ability of the patient to move their legs freely.
Do you have any problems moving your legs?
No. Assess dorsiflexion and plantar flexion of the feet and state their strength and their equality.
Go ahead and push against my hands. Go ahead and push against my hands. Equal strength on both sides.
At this time, ask the patient if they have any numbness or tingling in their lower extremities.
Any numbness or tingling down in your feet and your legs?
Nope. At this time, your physical assessment is complete. Be sure to perform hand hygiene, return the level of the bed to the lowest position, make sure your call light is within reach, and document the procedure.
And that is your head to toe assessment.